This week, members of the Institute of Medicine and the National Research Council visited Tulsa to find out more about its nationally recognized model for educating children before kindergarten. The council is using Tulsa and 2 other cities in the United States to conduct research on the future for children birth through age 8. They heard what Tulsa is doing right and where Oklahoma is still falling short when it comes to early childhood education.
Obviously, here in Tulsa, it starts with philanthropy. And we've got wonderful philanthropic organizations who are smart, studied in these areas, have a commitment to the long term as far as rather than just 1 year at a time type investments, what's it take over the long term, and very strong advocates to the business and to our legislative branches, and that's made a huge difference.
We have a full-day kindergarten in 52 Tulsa Public School sites. We have a full-day pre-K in 42 of our sites. We have a half-day pre-K in 4 sites and 3 full-time early childhood development centers, 2 that serve pre-K and 1 that serves K. We are serving the greatest number of pre-K children in the state.
And the good news is that what we're able to see is that the pre-K efforts that we're making, that we all know and take great pride about, are making a big difference. And we're able to differentiate those children who have come from and gone through pre-K versus those that haven't. Just so you all know the numbers in terms of the percentage of eligible kids in Head Start, that is below 100% of the poverty level. We're reaching more than 50% of the at-risk 3-year-olds and have them in Head Start, which essentially means they're getting 2 years worth of pre-K. I think that's a bigger number than any other community in the country has been able to do. But the downside is that we at CAP have a very long wait list for our infant and toddler care. Educare has a very long wait list, and there is a severe community shortage of high-quality slots. If you just thought about that as 3-star level as the standard that we want at a minimum for all kids, there are just far too few slots for kids to go to. DHS is not paying adequate reimbursement rates to support those slots from an economic viability standpoint.
I am very concerned about the fall off at the 1st and 2nd grade. We've done some research on that, trying to better understand why kids coming out of very high quality preschool programs on level are dipping at the 1st and 2nd grade. We own that. We have to face up to that. We have to work with our partners to make sure that we attack that gap, and we're working very diligently to do that. Again, we have staffing shortages in early childhood. Currently, we have 4 unfilled openings in pre-K because we just can't find enough people. We are working diligently to see to it that we have better professional development and that we have a recruitment program that aggressively recruits people into the program.
What help do you need from either the state or the federal level in order to really make your model the model you want it to be? What obstacles are there at the federal level, if you'd like to stay there? What obstacles are there in terms of practice or policy?
The research is really clear about what we should be doing for children, and it doesn't seem to make much difference in policy.
There's just no way you can be pro-education and cut taxes with where we are. And I don't know why we vote for it.
The number of kids that we have that have mental health referrals is through the roof, and for child care settings and pre-K settings that don't have the supports that we have in our classrooms, I can't imagine what that does for the teachers that, however well-intentioned and well-trained they are having to deal with those kind of issues in the classroom.
Our policies and our legislation are not very culturally responsive, and so, and when I say that, I mean that we do not present a very equitable playing field for our children from the get-go.